Well, every day a normal heart beats about 100,000 times, about 60 to 100 beats per minute. However, for people with abnormally slow heart rhythms, heartbeats can drop below that 60 BPM threshold and cause some serious problems. Well, joining us with some more details and a real solution are Dr. Larry Chinitz and patient Janet Marcel. So, doctor, let's start with you. What happens when your heart slows down? Is it life-threatening, and are there treatments for it?
Well, it can be life-threatening, but more commonly, patients start to experience lightheadedness, a sense of dizziness, or maybe actually start passing out. When we discover that patients do have an abnormally slow heart rate, the only real intervention that we can do is to implant a pacemaker, a device that can increase the heart rate and respond to the body's demands.
Janet, talk a little bit about your condition and how long you've been suffering and what the symptoms are like.
The most prominent symptom was I have had fainting spells my whole life since I was a kid, all the way up to a couple of years ago. It was very scary. It was very confusing. I was passing out driving, taking the train to work. Just all the daily things were very difficult.
Doctor, can you discuss your involvement in the clinical trials?
I was the principal investigator at the NYU Langone Medical Center, and we were part of a trial that included 56 centers around the world who were testing this new implantable leadless pacemaker into patients who fit the criteria of abnormally slow heart rates. And the responses and the results of the trial led to the FDA approval of this leadless pacemaker.
What has your experience been like with the new pacemaker?
Well, having been in this business a long time, it is truly phenomenal. It's a very easy implantation. It requires no surgical incisions. It's threaded up through a vein using a catheter and implanted directly into the heart with really minimal need for manipulation. It also eliminates many of the problems that were associated with traditional pacemakers, such as infections and lead fractures, and possibly the need to extract the devices.
How else is it different from other pacemakers?
The leadless pacemaker encompasses all of the technology, the generator, the battery, the leads, the sensors, all into a small device that's about the size of a small or larger vitamin. And again, by eliminating all of that other technology, it results in a simple implantation with very minimal and very few side effects.
Janet, how has the new pacemaker affected your life?
It's changed quite a bit. I can get up and live a normal daily life and do all my things without the anxiety, without the panic, without worrying that I'm going to crash my car or faint on my way to work. Just all the little things and the big things.
Well, doctor, what recommendations do you have for people who may be interested in improving their heart function?
Well, I think like Janet's story, it really requires you to explain your symptoms very clearly to your physician. Make sure that you're fortunate enough to have a doctor who listens carefully, who's aware of all of the new technology that is available for treatment of these symptoms, and hopefully to get to the right place at the right time, because pacemakers really eliminate all of those symptoms. A well-implanted device, especially one like the Micra, can restore normal functioning to people immediately. And I do think Janet's a really great example of that.
What resources are out there for people to get more information?
Well, after you talk to your doctor, the best place is the website at the NYU Langone Medical Center. That website is www.nylangone.org. Very robust website with lots of information.
Thank you both so much for joining us.
Thank you.
Thank you.
Now stay right where you are. Morning Blend's going to be right back.